The IFCR's CDKL5 Centers of Excellence help affected families access a team of multidisciplinary specialists. The clinic model eases the burden on families by bringing all specialists together, saving families time and hassle while ensuring that their medical team is able to work together. Each CDKL5 Center of Excellence team consists of a variety of specialties, including, but not limited to, epilepsy, genetics, gastroenterology, physical medicine, rehabilitation, and palliative care. Our CDKL5 Centers of Excellence work to continually advance our understanding of CDKL5 deficiency disorder. They are researching how the condition unfolds so that standards of care can be developed for this disease. IFCR sponsorship makes the CDKL5 Centers of Excellence possible. We provide the coordination that brings the specialists together and fund the multi-center research. Hear from the CHOP team about what you can expect when you visit the CDKL5 Center of Excellence in Philadelphia, Pennsylvania.
So at our Center of Excellence, we offer families a multidisciplinary clinic setting. And so families are really able to meet with multiple providers while remaining in the same space. So we have each of our team providers that includes neurology, genetic counseling, our nurse practitioner, occupational and physical therapist come to the family in the same space while they remain in the same room. This allows our care team to collaborate with one another and to create a cohesive plan of care for each patient to provide with the family before they leave. And it also makes things easier on families to decrease the burden of having them moving from room to room, floor to floor, and trying to navigate the hospital system, especially for families who may not be familiar with the CHOP layout. As part of our COE program, we also have families consistently meet with the same neurology providers, genetic counselor, gastroenterologist, occupational therapist, and physical therapist at each visit. This allows for us to provide consistency for the care of patients and also allows our providers to gain expertise across the spectrum of CDD to be able to improve management of disease as well as generate potential areas of ongoing research for future studies related to care of CDD. For families who may find that overwhelming, we do also offer more limited visits where they may be able to meet with just neurology or just neurology and gastroenterology, depending on their own preference and their child's needs. So the COE visits in our multidisciplinary clinic are held on the third Thursday of each month. We typically have visits start somewhere between 8 or 10 a.m. and they last somewhere between 2 to 4 hours, depending on how many team members are seeing each patient. Many families also elect to participate in research, and in some cases, this may add a little bit of additional time in clinic, depending on what portions of the research study they may be participating in. And in some instances, it may require a return visit. For children who have epilepsy and may require an EEG, we're usually able to coordinate that for the same day if needed. So visits to our COE typically are covered by insurance. There is typically an individual copay for each specialist where indicated by your insurance plan. For families in whom insurance may not approve a visit to our clinic, we are able to offer a financial estimate to a family before they choose whether or not to visit, so they are able to know in advance what types of out-of-pocket costs they may anticipate based on a trip to our clinic. We do also accept multiple out-of-state Medicaid plans, though of course this may vary depending on the state and may vary based on whether or not an approval is able to be obtained. So our site is also active for CDKL5 research, and families who are coming to our clinic are offered the option to enroll in any studies for which their child is eligible. We have both observational natural history studies, as well as more involved clinical trial drug studies. And families are also kept abreast of any ongoing or soon to be occurring research studies. So if a family comes to visit us and a study becomes open to enrollment after their child has had their visit, our study team will keep track of those patients and will reach out to families to contact them to see if they're interested in enrolling in research whenever the opportunity arises. Research is not a requirement to be seen by our COE, but we certainly encourage families to participate whenever they are interested. For families who may not be able to travel to our COE, if we have established care with that patient and seen them at least once in clinic, we're also often willing to work with their home team and their local providers to make recommendations for therapy and medication as needed. Depending on the current legal situation and insurance permissions, we in some cases are also able to offer telehealth appointments to decrease the burden of families needing to travel all the way to our site. But of course, this is constantly evolving.
What's fun about a COE visit? Well, you get to meet with a lot of people in our team and get to see the interactions amongst all of the physicians and nurses and therapists, which makes it a more dynamic visit than your typical visit to the doctor. Philadelphia is a fun city. There's a lot of good things that you can do with your family if you come to our COE in Philadelphia. Of course, if you're nearby, you can always stop and get a cheesesteak that everyone loves to do after clinic's over, to get a cheesesteak for lunch.